7:40 on a Tuesday morning. You're watching Breakfast Television. Dr. Shaireen is with us. She's the owner of Yaletown Dentistry because I have just found out about something called acid wear, and this scares me. What is this?
Well, acid wear is actually a softening of the tooth enamel, which is that hard, white outer layer of our teeth.
Right.
When our teeth come exposed to acidic substances, mostly through our foods, that enamel becomes softened. And combined with brushing aggressively, we can really wear away at our enamel.
Okay, the scary part about this is that it's becoming worse because of healthier foods that we're eating. Explain that.
Well, healthier diets tend to be higher in acidity. Things like fruits, juices, even salad dressing, these types of things are fairly acidic, so they do tend to soften our enamel more so than other things.
And so then you brush to compensate for the fact that your teeth don't feel great, and now you're saying that that's too much brushing is bad.
Well, it's important when you do snack on acidic fruits and juices and whatnot, it's important not to brush right away. That's when your enamel is the softest. So what you want to do is wait about an hour before brushing to allow the acidity in your mouth to neutralize.
Oh, okay. So you still can brush often, but just make sure you do it an hour after you eat something.
Exactly, and it's not just about sort of how often you're brushing, but what you're brushing with and how aggressive you're brushing. So you want to brush softly with a gentle toothbrush.
Okay.
And it's also important to choose a toothpaste that's soft, non-abrasive.
Okay, what can happen if you don't monitor something like acid wear? Like, how bad can it get for your teeth?
Well, acid wear is one of those things in the early stages, most people don't know that they have it. In the early stages, it can only cause sort of minor sensitivity to hot and cold, and maybe some minor yellowing of your teeth. So it's important to see your dentist regularly so that your dentist...
You have a picture, actually, of what sort of the minor part looks like, right? This is sort of the first early on look, and that's it right there?
Yeah, so in the early stages, it causes some yellowing of the teeth. Teeth can become more transparent. In advanced stages, however, it can really start to crater the teeth. Teeth tend to appear sort of more worn away and more translucent.
And so we have a look at that as well, sort of what happens when it really progresses.
So this is really a progressive state, quite severe. And I mean, in the advanced stages, it can lead to very costly, involved dental procedures. And so that's why it's very important to just sort of monitor this with your dentist and have your dentist examine you for signs of acid wear.
Okay.
Because almost everyone has signs of it. I mean, it affects everyone with natural teeth, and 90% of dental professionals in Canada are seeing patients in their practice with acid wear.
Really? Okay, and you brought some of the food groups along with you that's caused problems, right?
Yeah, well...
Or that you have to watch out for, we should
Exactly.
say.
Well, it's important to understand that healthier foods are higher in acidity, things like juices, fruits, salad dressing, of course, things like pop, even diet pop, iced tea, all those things are fairly acidic. So it's important just to sort of, I've got some tips for you as far as to what you can do about that, but it's important to realize that when people are snacking a lot on these types of things, it's important to understand what they do to your teeth so you can combat the effects of it.
Okay, so what can you do?
Number one, you need to make sure you're not eating throughout the day. If you're sipping orange juice throughout the day constantly, you can cause significant acid wear on your teeth.
And you actually said use a straw.
Yeah, well, using a straw is very helpful, directed towards the back of your mouth, so you keep a lot of the acidity off your teeth.
Okay.
So that's definitely a good tip. The other thing is trying to balance your meals, and I've got a couple things here to sort of show you. These types of things help to neutralize the acidity. So if you snack on these things, but you drink lots of water, you neutralize with a lot of dairy products like milk, cheese, yogurt. If you eat a lot of raw vegetables like carrots, celery, nuts are great.
So those actually help?
They help to neutralize the effect of the acids.
Okay.
So that's definitely things that you can do to sort of prevent more damage.
And then when it comes to the brushing,
so brushing, there's some important things that we need to do. We already touched on some of them.
Right, which is brush an hour after you have a snack. And
after you have something high in acidity, so a fruit or juice, it's important to wait about an hour before brushing. It's also important to make sure you're using a soft toothbrush and you're not scrubbing your teeth.
Okay.
It's also helpful to use a really soft, non-abrasive toothpaste. You know, that's the trick is toothpaste these days are far too abrasive.
Well, I was going to say, toothpaste these days have everything in them, don't they? They want to help you fight everything.
For sure. Well, the whitening toothpaste, the toothpaste bicarbonate, sodium bicarb, those are very aggressive, very abrasive. So you want to use something that's more gentle,
mild
more
toothpaste,
non-abrasive.
soft toothbrush, and watch when you brush.
Exactly. And see your dentist regularly because it's important to catch this in the early stages.
All right. Well, thank you very much for the advice this morning. Let's find out what's making news. Here's Mark.